Hello, this is Gautam Thelu. My project is about spreading of human immunodeficiency virus with perinatal infection. HIV is not fatal. It is now regarded as a manageable condition. Steve Longnecker was already developed a simulation model using NetLogo application. Steve model was mainly developed based on transmission of HIV via sexual activity. The aim of this study is to add transmission of HIV through perinatal, where the virus transmits from mother to child during the birth or breastfeeding. Assumptions were made on the sexual behavior and childbirth for the simplification of the code. More than the interrelation between variables, the effect of perinatal infection of HIV were focused. Model was tested for the ability to simulate actual conditions using various states of variable. Steve's simulation model on HIV transmission can be found on the NetLogo model library. In this study, I had included perinatal transmission. Data were retrieved from the United States Center for Disease Control and Prevention and World Bank database. All data were manipulated to meet our requirement. For example, the death rate is usually calculated per thousand in population, but here the model needs the percentage. Perinatal infection tendency and average coupling tendency variables are used. The perinatal infection tendency is a tendency where a new birth is infected. The time in which a couple engages in sexual activities can probably decide the birth rate, but in this study it was assumed as constant. The perinatal infected patients were colored differently to identify them. The, the United States rates of births and deaths were used. To simplify this model, we have taken the birth rate as 1.8% and death rate was set to 0.9%. Both rates are considered as constant. Slider values for perinatal infection tendency and average coupling tendency ranges from 0 to 10, where value 10 indicates 100% of births are HIV infected, while 0 indicates 0% of births are HIV infected. If, if you see results, when perinatal tendency variable is placed at 5, we can see no single perinatal infections even after 265 weeks. We can see few perinatal infections after 500 weeks in this slide, but when perinatal tendency variable is changed to 10, increment of perinatal infection is observed in this slide. Perinatal infection is not significant in number but more sensitive and important for the management of public health. The aim of the society is not to reduce perinatal HIV infection but to eliminate it. Therefore, even small number will give significant impact. Thank you.